If you've ever typed Sertraline side effects into Google and immediately felt your stomach drop, you're not alone. Zoloft can help some people, but the warning list can look intense fast. I'm going to translate the label into normal language, and there's one detail people miss that changes how you read the whole thing. Quick safety note before we start. This is educational only. I'm not telling you what to take, how to take it, or whether you should start, stop, or change any medication. For personal decisions, talk with your doctor, pharmacist, or another qualified clinician. When, where, and who made it. Sertraline was developed by a Pfizer research team in the 1970s and introduced under the brand name Zoloft. It received its original U.S. approval in 1991. Today, it's widely used and available as a generic, so you'll often see Sertraline on the label even when people still call it Zoloft. What it is and what it's used for. Sertraline is in a class called SSRIs, selective serotonin reuptake inhibitors. That sounds technical, but the concept is simple. SSRIs change how the body handles serotonin, a chemical messenger involved in mood, anxiety, and stress response. On the official label, Sertraline is used for major depressive disorder. It's also approved for obsessive-compulsive disorder, panic disorder, post-traumatic stress disorder, social anxiety disorder, and premenstrual dysphoric disorder, also called PMDD. You may also hear it discussed for generalized anxiety. That's sometimes prescribed off-label. Off-label doesn't automatically mean unsafe or wrong. It just means it's outside the exact wording of the approval, and it should be a clinician-led decision based on the full picture. What it does in the body, in plain English. Think of serotonin like a signal passed between nerve cells. After the signal is sent, serotonin usually gets pulled back in and recycled. Sertraline slows that recycling step, so serotonin can hang around a bit longer where nerve cells communicate. That doesn't mean it adds serotonin in a simple way, and it doesn't mean you suddenly feel happy. For many people, it's more like turning down background static. It may help smooth out mood swings, soften the intensity of panic, or reduce that sticky, repetitive thought loop feeling in OCD. It can also take time for the nervous system to adjust, which is why the early phase can feel different from later on. Also, serotonin doesn't live only in the brain. A lot of serotonin activity is in the gut. That's why some of the most common effects feel very physical, especially at first. Hold on to that thought because it connects to what people usually notice next. Common side effects, the real-life version. I like to split this into two buckets: common and annoying, and less common but important. Common and annoying. Stomach upset is probably the headline here. Nausea, loose stools, a weird queasy feeling, sometimes appetite changes, headaches can happen, sleep can shift too, either trouble falling asleep, waking up more often, or feeling more tired than usual. Some people feel a little jittery, restless, or revved up early on. Others feel kind of flat or foggy. Sweating and a mild tremor can show up in some people. None of this is guaranteed, but it's common enough that you'll see it mentioned again and again. And then there's the one people hesitate to say out loud: sexual side effects. Sertraline can reduce desire, make it harder to climax, or make things feel muted for some people. If that's you, it's not in your head, and it's not a moral failing. It's a known effect worth discussing with a clinician. Less common but important. This is the bucket that matters because it can signal this isn't a great fit or something is stacking. Some people experience strong agitation, irritability, or mood changes that feel out of character. Rarely, antidepressants can trigger mania or hypomania, especially in people who have bipolar disorder that hasn't been recognized yet. That can look like unusually high energy, racing thoughts, risky decisions, or not needing sleep. There's also a risk of low sodium in the blood, especially in older adults or people taking certain diuretics. Low sodium can show up as confusion, severe headache, weakness, or feeling unusually unsteady. Now here's the mini cliffhanger that's actually useful. A lot of the serious stories people hear are not just sertraline. They're sertraline plus another medication, supplement, or substance that pushes in the same direction. Red flags and serious warnings. If someone on sertraline develops symptoms that feel sudden, severe, or scary, that's not the moment for guesswork. Contact a clinician urgently, and if it feels severe, seek urgent medical care. What kinds of symptoms am I talking about? A major one is intense worsening of depression or new suicidal thoughts, especially in children, teens, and young adults. Antidepressants, including sertraline, carry a boxed warning about increased risk of suicidal thoughts and behaviors in people under 25, particularly early in treatment or when changes are happening. The practical takeaway is to watch for sudden mood shifts, severe agitation, unusual irritability, panic that feels sharper than your baseline, or behavior that feels clearly out of character. If that shows up, a clinician should know about it quickly. Another rare but serious warning is serotonin syndrome. It's uncommon, but it can be dangerous, and it's more likely when sertraline is combined with other serotonergic substances. Symptoms can include a cluster of things like confusion, fever, heavy sweating, fast heart rate, diarrhea, tremor, muscle stiffness, and severe restlessness. If that kind of cluster is happening, seek urgent medical care. A third category is allergic reaction. Swelling of the face or throat, trouble breathing, or widespread hives is urgent. And one that surprises people, eye symptoms. SSRIs can trigger angle closure glaucoma in people who are predisposed. Sudden eye pain, vision changes, or seeing halos around lights is not something to sit on. Things not to mix and what to double check. I'm going to do this in real-world categories because that's how people actually live. Alcohol. Alcohol can stack side effects like sleep disruption, dizziness, slowed reaction time, and mood instability. Some people notice very little, others notice a lot. If alcohol is part of your routine, it's worth a quick double check with your clinician so you're not guessing. Other meds that stack serotonin effects. This category matters because of serotonin syndrome risk. Examples include other antidepressants, MAO inhibitors, some migraine medications called triptans, the pain medication tramadol, lithium, and some cough medicines that contain dextromethorphan. You don't need to memorize every drug name, just remember the theme. If it also boosts serotonin signaling, it's a double check with a clinician situation. Specific combinations that are treated as a hard no. MAO inhibitors are the classic one. Certain medications used in hospital settings like linezolid or intravenous methylene blue can also create dangerous serotonin effects when combined with an SSRI. And pimozide is specifically contraindicated with sertraline because of serious heart rhythm concerns. Bleeding risk stackers. SSRIs can increase bleeding risk in some people, and the risk can be higher when combined with aspirin, NSAIDs like ibuprofen or naproxen, or prescription blood thinners. This doesn't mean everyone bleeds. It means bruising easily, frequent nosebleeds, a history of ulcers, or being on a blood thinner should trigger a deliberate conversation, not a shrug. OTC meds people forget about. Cold and flu combo products are sneaky. Some contain dextromethorphan. Some contain decongestants that can increase jitteriness or raise heart rate. NSAIDs are easy to grab without thinking. Allergy meds can add drowsiness for some people. When in doubt, ask a pharmacist. They can spot the hidden ingredient in about 10 seconds. Supplements and substances. St. John's wort is a big one with SSRIs. It can change serotonin effects and also change how some drugs are processed. Cannabis products can stack sedation or brain fog in some people. High caffeine energy products can amplify restlessness if you already feel activated. Vaccines, procedures, and special situations. If you're having surgery, dental work, or anesthesia, it's worth telling the care team you're on sertraline. It doesn't automatically mean a problem. It just helps them plan safely. The same idea applies to pregnancy planning or breastfeeding questions. That's clinician territory, and it's a good conversation to have early rather than late. Now, here's that detail I teased at the beginning, the one people miss. The label isn't a prophecy, it's a risk map. When you read a long list of side effects, it's not saying those things will happen to you. It's saying they can happen across a whole population, including people who are older, people taking multiple medications, and people with other health conditions that change the math. So the smarter question isn't, is Zoloft scary? It's, which risks are higher for someone like me, and what should I watch for? If you walk away with nothing else, walk away with that. It turns panic Googling into an actual plan. Quick takeaway. Sertraline, also known as Zoloft, is an SSRI used for depression and several anxiety-related conditions, including OCD, panic disorder, PTSD, social anxiety disorder, and PMDD. Common side effects often involve the gut, sleep, energy level, and sexual function. The biggest safety themes are mood changes in younger people early on, rare serotonin syndrome when serotonin effects stack, and interaction traps with NSAIDs, certain cough meds, and supplements like St. John's wort. Before you go, here are 3 questions you can ask your doctor or pharmacist. Based on my history and my current medications, what side effects should I personally watch for? Which over-the-counter pain, cold, or allergy products should I be careful with? What warning signs would make you want me to contact you urgently? That's MedLabel Translator. No hype, no panic, just the label translated into normal language.